Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Arthritis is one of the biggest problems that people in this country and actually throughout the world suffer from. And when we look at the statistics on it, it is really quite alarming. It's estimated probably about a quarter of U.S. adults suffer from arthritis. Now, there are two different types of arthritis. When we kind of break it down, you have rheumatoid arthritis and then you have osteoarthritis. And we know that the rheumatoid arthritis is always known as the autoimmune. And certainly we know that this is the case, that the immune system basically goes into a self-attack mode. But what's interesting is that the pathological process to which drives up the inflammation in osteoarthritis works along that same mechanism. So it used to always be thought of that osteoarthritis was solely just because of age-related and wear and tear. We now recognize that the immune system is actually playing a fairly profound component to the inflammatory process in both forms of arthritis. And when we look at the overall economic burden of arthritis in this country, it is really astronomical. I mean, when we look at the medical care costs, when you look at lost earnings, and just the economic impact is one of those areas for me, being in a public health mindset, is always interesting to look at, and understanding that the cost that they estimate of arthritis in this country is well over $300 billion per year. And that's kind of frightening. We also recognize that the total lost work days throughout the United States is estimated to be close to 200 million total lost work days per year, which is basically about 35% of the reported lost work days for any medical condition. So when you look and you see why someone misses work, is it because they had a cold? Is it because they had, the flu or headaches? Arthritis makes up 35% of the main reason as to why people can't make it into work. So we know that the long-term implications in terms of the socioeconomic components to that, but also looking at the long-term health implications. Because when we think about arthritis, we're talking about the mental toll that can have on someone who experiences chronic pain each and every single day. And maybe they can't do the things that they want to do, take part of some of the activities that bring them joy in their life. So today I want to talk about some new updated research on UC2, which is type 2 undenatured collagen. It's actually a registered trademark form of type 2 undenatured collagen. And the reason why I want to bring this up is because this is the form, this actual clinically studied and proven effective way to target arthritis. We use this in our cartilage HX formulation. So UC2 is a registered trademark. We have this particular registered trademark nutrient in our cartilage HX formulation. So I want to talk about that in some more detail today. So I'm Amanda Williams, MD, MPH, and let's get right to it. So we know that about a quarter of the U.S. adult population has doctor-diagnosed arthritis. What does that mean? That means you've been to a doctor, you've talked about your problems, my knee is continuously hurting, my hip hurts, whatnot. We know that a quarter of the U.S. population roughly has doctor-diagnosed arthritis. Now, that doesn't take into account all of the many millions of Americans who have never maybe discussed their joint pain with their physician. So we know that number is actually much larger. And I talked about, briefly the economic impact when people are missing work because of their joints. And, they have stiff knees and they can't get out of bed, or they're in such pain, they have significant amount of inflammation. This is a really big problem when we look at it across the spectrum of our overall wellness, because it's not just, oh, geez, my knee is sore, or look at, I'm walking slower today because my arthritis is acting up. We're talking about the long lasting effects of that and the burden that becomes on someone's emotional well-being. So we do certainly know that. And we also recognize, the pathological process when we're looking at osteoarthritis, when we look at rheumatoid arthritis, and understanding that the two are driven by this overreactive immune system trying to basically go into a self-destruction mode within those joint spaces. And this is why UC2, which is in our cartilage HX, why this is so really unique. Because what UC2 is, it's a undenatured type 2 collagen. So when we think about collagen, we know that there are multiple different types of collagen. The most abundant is type 1. And type 1 is found throughout the entire body. That's what we think about with, our skin, with our hair, when we think about the bones, our joints, obviously. But type 2 is a really unique form. And when we have it in its naive structure, that undenatured structure, it allows the body's immune system to actually recognize that and say, okay, you're supposed to be here, so we don't need to go into this heightened state of attack, which is really just absolutely phenomenal. The fact that you can have collagen that does this to try to regulate the immune system. And so when they first came out, with UC2, it was kind of one of those things where they stumbled upon it in a sense, because you had researchers that were looking at, is chicken soup beneficial for the overall health? And of course, we clearly know the answer to that, and it's not just the old wives' tale that people would talk about. We recognize that in that bone broth, there is something that does a really phenomenal job in terms of helping to support our immune system. So researchers at multiple different collegiate level, university level research trials started to narrow it down, and they're like, you know what? It's this undenatured collagen that actually came from the chicken sternum. And from that, they said, this is doing something to kind of autocorrect an overactive immune system. And I think that is really quite phenomenal. And so the way that they kind of stumbled upon it is quite interesting. But then when you see just how powerful it is when it comes to targeting both osteoarthritis as well as looking at rheumatoid arthritis. Because remember, rheumatoid arthritis, this is autoimmune, and this is very severe. This is when people get, deformities within the joint spaces themselves. So there have been multiple studies now that have looked at just how beneficial that undenatured collagen can be in terms of immunomodulatory effects. So I want to talk about some of the new studies that have come out as of recently. And the reason why is because clearly we've seen the studies that originated with type 2 undenatured collagen, which, remember, this is a registered trademark form, so that UC2. Seeing those original studies and seeing that exposed collagen within the joint space is what was creating this overabundance of the immune system. So you get the kind of that wearing away of the collagen, the type 1 collagen, and then the immune system wants to go into the attack mode. So what they recognize is that if they could target kind of the way that the T cells, the killer T cells in particular, were working within that joint space, then they could probably do a lot of correction with the destruction that actually occurs. So in a way, it's kind of working when we think about vaccinations, for example, oftentimes with UC2, they describe it as it acting as a kind of reverse vaccine. It's regulating the immune system so it stops mobilizing the attack on itself. So I think that that's really quite interesting. So the initial studies they were doing with UC2 were both in animal trials, but also in human trials, and looking at its effectiveness in osteoarthritis. Now, I think that that's something certainly to be notated. In the veterinary studies, those were really kind of interesting too. They found that when they gave UC2 to dogs, and you think about some of the bigger dogs like labs and things like that, where they are more prone to issues with hip dysplasia, they found that when they gave these dogs UC2, their mobility started to return, and they were definitely acting more youthful. So I think that in and of itself is very impressive. But then when you look at the way it is working in human trials, so they said, okay, well, we can probably replicate this in humans. And indeed they did. So multiple different, and they went across the spectrum. They took people who had diagnosed osteoarthritis. They took athletes who had complained about joint pain. And then they stepped it up and they said, now let's look and let's take kind of our worst case scenario, and let's take people who have actually been diagnosed with rheumatoid arthritis. So all the way back in 1998, in the Journal of Arthritis Rheumatology, they put out their findings, and this came from Beth Israel Deaconess Medical Center in Boston. They looked at how effective UC2, this registered trademark form, how effective this could be in patients with RA. And what they found from baseline to the end of their trial was that the positive effects were observed in the group that was given type 2 undenatured collagen. So they didn't have any side effects, because you think about a lot of the different medications that are out there, they're immunosuppressants. They're trying to just stop the immune system from attacking. But this was working differently. So when we talk about immunomodulatory, so this is helping the immune system recognize. Remember, we're trying to get the immune system to say, okay, no, that's normal. We don't need to go into a full attack. So when they showed that UC2 could be beneficial in the treatment of rheumatoid arthritis, then a lot more scientists kind of were like, okay, let's research this in more detail. So now you've had this steady increase of people looking at type 2 undenatured collagen. So in the Eurasian Journal of Medicine, they were looking at the effects of type 2 collagen in the treatment of knee osteoarthritis. So this was a randomized control trial that they did. So they took a group of people who were used to just taking NSAIDs, taking their acetaminophen, taking, their ibuprofens, and they wanted to see if we give them UC2, will this do anything after 3 months? So we'll take them off of their NSAIDs and we'll have them take UC2. What difference would this make? And then they had another group that they just said, okay, you just stay, solely just on your NSAID, and let's just see the difference. And what they found was that the group that was given UC2 had a significant improvement, not only in their reporting of inflammation, but also the, pain. And for many people, that's the most common complaint is, my joints are stiff. I'm in a lot of pain. So that's why they turn to the over-the-counter NSAIDs. Now, that particular study, that one came out just a couple of years ago, but there was another study, which was a veterinary study, once again, looking at the utilization of UC2, comparing that to one of the COX-2 inhibitor drugs. So we know when we're looking at the different inflammatory pathways, we know that we have the LOX pathway, the COX pathway, which is the cyclooxygenase pathway. And what they were able to determine from this, we know that those COX-2 drugs can come with a whole slew of different side effects. And in doing this particular study, they found that UC2 was very effective in improving mobility in dogs that had significant arthritis. Yet they took away that risk that COX-2 drug, that alternative, the actual medication, what that could actually do to the dogs. And for many people, they don't want to be giving their pets medications if it's not warranted. So this is another study that came out once again, just reinforcing that fact with type 2 undenatured collagen. And they went through and they kind of just summarized all of the effects of UC2 on joint health and the function, and how this can help to improve overall health in those disease states that we mentioned, the osteoarthritis and the rheumatoid arthritis. So I think it's an interesting point just to be noted that when you see this very powerful natural substance, UC2, and this is, remember, that's undenatured type 2 collagen, but we use the registered trademark form, the one that is continuously shown in all of these clinical trials to be beneficial across the board, whether we're looking at, osteoarthritis, whether we're looking at rheumatoid arthritis, whether we're looking at arthritis in animals. We continuously see that this particular form, this registered trademark form that we use, is highly efficient and effective. And so I just like to always keep people up to speed when it comes to the different science behind the nutrients that we are using, because sometimes we forget about it. We forget that cartilage HX is this really super formulation that contains this powerful natural substance that has been shown time and time again to have such a enormous amount of benefit for people who are dealing with joint discomfort. We know that that's a good quarter of the US adult population. And as I mentioned before, that's just the ones that we know have been diagnosed. That's not counting in the people who get up and say, oh, gosh, it takes me a while to get going in the mornings. My knees are stiff or my hips are stiff, whatever be the case. This is a really wonderful thing to have on board as part of your supplementation routine if joint health happens to be a concern for you. And I just always like to mention, it is so easy to take. It is one small tiny capsule, and you only have to take one per day. And generally the question that will come up is, well, how long before I know if it works? Well, I always say the majority of the clinical trials are usually in that 3-month window. So we're talking at least, 90 days. For some people, they will start to see those benefits much, much sooner. For others, it may take up to that 3 months before you start to see that benefit. Because remember, what we're doing is we are trying to have a very serious conversation with our immune system. We are trying to tell the immune system, hey, we don't need to destroy our joints. So for some, it may take a little longer, but at the end of the day, it would be advantageous to utilize something that the human body can recognize, and it is natural, as opposed to putting all of these, NSAIDs into your system each and every single day, which over time can certainly become incredibly problematic. So these are always just things to think about. The one thing that I would say is, if you are not sure if your joint health routine right now is the right one for you, definitely, speak to one of our healthcare experts, and they will be able to guide you to make sure that you're on the right nutrients, that you're taking them the right way at the right time during the day. All of those different factors can certainly make a difference in terms of how you feel each and every single day with your joint health. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. And do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. And we will see you next time for another episode of the Invite Health podcast.